Water treatment in medicine: hot and cold water therapies for musculoskeletal conditions. This video explores the application of hot and cold water treatments in managing musculoskeletal conditions, specifically focusing on back pain and injuries like broken or sprained bones and muscles. The investigation includes a review of various theories, the physiological effects of temperature on the human body, and an analysis of the efficacy of these treatments based on existing research and data. Water therapy, known as hydrotherapy, has been used for centuries in different cultures for healing and pain management. Its application in modern medicine, particularly in treating musculoskeletal conditions such as back pain, broken bones, and muscle sprains, offers a non-invasive and accessible treatment option. This paper aims to delve into the therapeutic use of hot and cold water treatments, examining their effectiveness, mechanisms, and applicability in treating back pain and injuries to bones and muscles. The focus will be on analyzing the physiological effects of hot and cold water on the human body, different therapeutic approaches, and their outcomes in managing pain and promoting healing in musculoskeletal conditions. Thermal therapy theory. This theory posits that the application of heat and cold can significantly influence body tissues, leading to various therapeutic effects. Heat is believed to enhance blood flow and relax muscles, while cold applications are thought to reduce inflammation and numb pain. Gate control theory of pain. This theory suggests that pain signals can be blocked or modulated by certain physical stimuli like temperature changes, which might explain the pain-relieving effects of hot and cold water treatments. Biopsychosocial model. This model emphasizes the interaction between biological, psychological, and social factors in pain perception and management. It suggests that water therapy can have a multidimensional impact on pain relief and recovery. Hot water treatment. Mechanism of action. Hot water treatment, or thermotherapy, involves applying heat to the affected area. It dilates blood vessels, increases blood flow, and reduces muscle spasms. Applications in back pain. Heat therapy is often used for chronic back pain. It relaxes tight muscles and alleviates discomfort, facilitating greater mobility and comfort. Case studies. Several studies have shown significant pain reduction and improved mobility in patients with chronic back pain following regular hot water therapy sessions. Cold water treatment. Mechanism of action. Cold water treatment, or cryotherapy, involves applying cold to the injured area. It causes vasoconstriction, reduces blood flow, and decreases inflammation. Applications in bone and muscle injuries. Cold therapy is commonly used immediately after acute injuries like fractures or sprains to reduce swelling and pain. Case studies. Research indicates that patients who received cold therapy post-injury reported lower pain levels and faster recovery times compared to those who did not. Comparative analysis of hot and cold water treatments. Efficacy in different conditions. While both treatments are effective, their application depends on the nature of the condition. Chronic conditions often benefit more from heat, whereas acute injuries respond better to cold. Synergistic use. In some treatment protocols, alternating hot and cold therapy is used to maximize the benefits of both. This approach is believed to stimulate blood flow while simultaneously reducing inflammation. Patient response variability. Individual responses to hot and cold treatments can vary significantly based on factors like age, condition severity, and personal tolerance to temperature changes. Physiological effects and safety considerations. Physiological impact. Both therapies significantly impact the circulatory, muscular, and nervous systems. They can alter pain perception, tissue healing, and inflammation. Safety and contraindications. While generally safe, these therapies have contraindications, such as certain cardiovascular conditions. Proper assessment and guidance from healthcare professionals are essential. Best practices. Guidelines for duration, temperature, and frequency of treatments are crucial to maximize benefits and minimize risks. Future directions and innovations. Technological advancements. Innovations in hydrotherapy equipment and techniques promise more precise and effective treatment applications. Integrative approaches. combining hydrotherapy with other treatments like physical therapy, pharmacotherapy, and alternative medicine could enhance overall treatment efficacy. Research needs. Further studies are needed to understand the long-term effects and optimize treatment protocols for specific conditions. Conclusion. Summary of findings. Hot and cold water treatments offer valuable therapeutic options for musculoskeletal conditions with distinct mechanisms and applications. Clinical implications. These therapies provide non-invasive, cost-effective options for pain management and recovery in various musculoskeletal conditions. Future prospects. With ongoing research and technological advancements, the scope and efficacy of hydrotherapy in medical practice are likely to expand further, offering enhanced relief and recovery options to patients. This research video provides a comprehensive overview of the application of hot and cold water treatments in managing musculoskeletal conditions. The interplay of physiological, psychological, and social factors in pain management through hydrotherapy is explored, offering insights into its efficacy, mechanisms, and future potential in medical practice. The Healing Waters of Ancient Wisdom. Chapter 1. The Discovery. In the bustling city of Shanghai, a young physiotherapist named Li Wei discovered an ancient scroll while renovating his clinic. The scroll, dating back centuries, detailed the secrets of ancient Chinese water treatments for muscle and body pain. Li Wei, intrigued by the potential of these methods, decided to integrate these practices into his modern physiotherapy techniques. Chapter 2. The Ancient Scroll. The scroll spoke of using water's natural properties to heal. It described how warm water could soothe and relax sore muscles, a concept supported by modern research showing heat therapy's effectiveness in increasing blood flow and reducing muscle spasms, much like in the comprehensive research papers Li Wei studied at university. Chapter 3. The First Experiment. Eager to test these theories, Li Wei invited his client, Mr. Zhang, who suffered from chronic back pain. He started with a hot water treatment, immersing Mr. Zhang in a warm bath, mimicking the natural hot springs revered in ancient practices. As Mr. Zhang relaxed in the bath, Li Wei explained how heat therapy relaxes tight muscles and alleviates discomfort, echoing the findings from the research paper he had studied. Chapter 4. The Power of Contrast. After the warm bath, Li Wei introduced Mr. Zhang to a contrasting method, rinsing his feet with cold water. This practice, rooted in ancient wisdom, was akin to modern cryotherapy, which reduces inflammation and numbs pain. Li Wei recalled the research paper's notes on cold therapy's effectiveness after acute injuries, sharing these insights with Mr. Zhang. Chapter 5. Integrating Modern and Ancient. In combining these ancient techniques with his physiotherapy knowledge, Li Wei developed a unique treatment regimen. He included alternating hot and cold therapies, a synergy of old and new wisdom, enhancing blood flow while reducing inflammation. This approach mirrored the comparative analysis of hot and cold water treatments detailed in his research studies. Chapter 6. The Widespread Impact. Word of Li Wei's success spread throughout Shanghai. People with various muscle and body pains began visiting his clinic, eager to experience the ancient Chinese water treatment methods integrated with modern science. Li Wei always emphasized the importance of safety and individual responses to temperature changes, a precaution he learned from his extensive research. Chapter 7. A New Era of Healing. Li Wei's clinic became a sanctuary for those seeking relief from pain. His methods, a blend of ancient practices and modern research, opened a new chapter in holistic healing. He often thought of the research paper that had shaped his understanding, grateful for the knowledge that enabled him to bridge the gap between ancient wisdom and contemporary science. Chapter 8. Legacy of the Ancient Scroll. As Li Wei's reputation grew, so did his desire to share his knowledge. He began conducting workshops, teaching others about the therapeutic powers of water, both hot and cold. He shared stories from the ancient scroll, intertwined with the scientific insights from his research, subtly educating his audience on the benefits of water therapy for muscle and body pain. The healing waters flow on the ancient scroll, once hidden in the walls of an old clinic, had sparked a revolution in pain management. Through Li Wei's dedication, the wisdom of the ancients flowed seamlessly into the realm of modern healing, proving that sometimes, the most effective remedies are those that have been flowing through history, like water, timeless and enduring. Thanks for watching. Please like this video and subscribe to our YouTube channel at Research Forum Online. Check out the research paper at researchforum.online.